Prof, thank you so much for your time.
Thank you for having me.
Now, maybe we should start this at the very beginning. There's a difference between COVID-19 and the coronavirus. I understand the coronavirus is a group, while COVID-19 is a subset. Yes. Can you explain the difference?
Well, coronaviruses have been in existence from time immemorial. After the First World War, 1918, we had the first flu influenza pandemic that killed millions of people at that time. And since then, even the Qatar, the common cold you have, flu and all of these that are prevalent in the Western world are all caused by coronavirus. There are over 200 genetically related viruses in this coronavirus.
200?
Yes, over 200,
wow.
Yes.
So this COVID-19 is just one?
It's just one. And it's the latest, that's what we call mutation in medicine, when an organism changes the architecture of its genetic makeup. Okay. When that happens, some mutation has taken place. And when that takes place, you have change in characteristics of that organism. It may become more infectious, more contagious, or even non-infectious, depending on the pathway the mutation leads the organism. So in 2003, we had SARS in China.
That's
and
right.
The virus. That was from coronavirus. That's why they call it COV-1.
Okay.
Is it? And then you have MERS in the Middle East, which is the Middle East respiratory syndrome. COV-2. Okay. They're all coronaviruses. Now, this Wuhan virus now is the latest mutation of the coronaviruses. Okay. And the WHO just called it COVID-19, which is coronavirus disease coming up 2019. That's the full meaning of COVID-19. Coronavirus disease coming up in 2019. So they want to use that to differentiate it from the other sisters and brothers of the corona group family that this particular
one is from. Now, if we zero in on this COVID-19, what are its essential characteristics in as simple a layman as language as possible for our viewers to be able to understand what this is about? Because we've been talking about it, but very few people have explained.
Well, generally, viruses are the smallest of the infective organisms. You have very big organisms, the protozoas, you have the bacteria, you then have the viruses. These ones, they don't live outside the body for a long time. They need some form of host to survive. And when they get in there, they'll take over the RNA of that host and use it to replicate themselves. That's the problem. You see it? Now, this particular one, having undergone this mutation, now it's like a zoonotic disease, which means you can get it from animals. Okay. You know, you must have seen the video initially. They were eating bats, eating rats, alive, raw. These are how these things came about. Even though America and China are fighting each other, whether it's a bio attack or whatever, but it's a virus, and it came from animal. The animals picked up this virus and transferred these viruses to man. Now, it's spread from person to person now. And the characteristic of this particular COVID is different from SARS. You see, SARS goes in the air. That's why people wear masks all over the place. But this one, except I cough very hard or sneeze very hard, I cannot infect you through the air. It goes in droplets. And these droplets, after a while, we just drop down on surfaces as I'm coming, and my hand, if I use my hand to do some coughing or sneezing, it settles on my hand, and whatever I touch it settles there. So this is the way it goes. Yes, it's moving around, infecting people. But one good characteristic of this, let's put it good imperative, is not as little as SARS or MERS, but it is far more contagious than those other ones. What I mean by that, the mortality for COVID is maximum 4.55%, which means if 100 people have it, only about 5 may die from it. Unlike what you have in SARS and MERS that have more than 60-70% mortality, or Ebola that has almost 80 to 90% mortality. But it spreads far, and because it gets more people infected, that's why more people are dying from it.
Yeah, because I was going to ask you.
Relatively.
I was going to ask you that not in Nigeria, thankfully, as we speak, but in some other countries like Italy. Italy is about the most prominent example outside of China now. Hundreds of people literally are dying per day.
As at the last count, over 7,000 people have died in Italy.
So
yes, it's the number.
Okay.
You see, when you have 70, 80 people infected, or even up to 100 people infected, then the mortality, when you relatively, we get higher. You see it. And also, it depends on the demographics of the country. Okay. Italy has a lot of old people, and this has been found to be more dangerous to old people, or people who have what we call comorbidities. They have other illnesses like diabetes, hypertension, heart disease, and so on and so forth. In those people, the immunity is down. That is one thing with viruses. We fight viruses with our immunity, not really with drugs. You can't find very potent drugs against virus. Even the ones like HIV, Ebola, and so on and so forth, it's the immunity of the individual that will fight it. Those other ones may help to reduce the count, but it never goes off completely. You see it? You can treat somebody with bacterial infection and it disappears completely, but not viruses. Most times, except the body suppresses it and then it disappears. You see, that is the way it does. And because it's not too little, a lot of people have it without knowing that they have it.
Those are the asymptomatic people.
The asymptomatic people. They are asymptomatic, but they are carriers and they are spreaders.
How does that work? Because when it was initially said that you can have it, exhibit no external symptoms of it, and yet be able to spread it.
Yes, it's inside your body. When you cough it out. It will not cause disease for you, but some other person that picks it, it will cause disease for the person. You see, that is the dangerous aspect of this COVID-19. If somebody has SARS or Ebola, symptoms come up very quickly, and you are likely to avoid that person early enough. But when somebody has COVID-19, he may not exhibit any symptoms at all, or the symptoms may just be mild, and he's going about his business. And you wouldn't even know that the person you are dealing with has it. You see, that's why it is. Just like HIV, early HIV, they say HIV doesn't show in the face. Early HIV, you may be going about your business until you develop AIDS. That's when it hits you down. So the same thing happens when you get this COVID-19. So it spreads insidiously from person to person without people knowing that they already have it. And that is why contact tracing sometimes may not be the best way to do it. You see, we did contact tracing during Ebola because Ebola is quite distant. You can show disease patterns and so on and so forth, so you can trace people very easily. But in this one, yes, even though the country is doing contact tracing, but it may not be as effective as it was with Ebola. But let's see how it goes.
But what if we're not to do contact tracing, which as you pointed out may not be completely effective, are there more effective ways of finding out who, for example, if someone has it?
Yeah, it would have been easier or better if you could do community testing. You see it? Particularly in an environment like we have it in Shagam now. You don't know who and who has picked it. You could get a cohort of people and do their testing. That you can catch them early. But it's expensive to do. You don't have even the kits to test those who deserve to be tested. So it's a very expensive venture. So all we can do is just do the much we can with testing those who have shown symptoms or those who have been exposed to those with symptoms, the contacts. That one you have real criteria for testing those ones. But going about the street, testing like you do screening for cancer, this and that, you can't afford to do that with this because the kits are very expensive, they're not very readily available. So when you spend it on people who don't need it, you may not have it for those who may
really
need
need it.
So that's the dilemma in that.
Now, there's a link between that and the strength of health systems.
Yes.
What COVID-19 has shown is that many of the health systems that we outside looking in may have thought were quite effective and efficient have been shown to be somewhat deficient. And by that, what I mean is that even in some of the more developed societies, countries, they have been caught flat-footed with this one in particular.
Yeah.
A mixture of several factors. But in terms of health systems, how best do you think health systems can work to tackle this?
Yes, Nigeria is trying. We are putting up some good fights for this. Immediately it came up in China and started spreading. The health system here started working, but it was not widespread. We didn't quite anticipate that. And with the erroneous impression we had before that this COVID thing may not come to Africa, that the black man is slightly resistant to it, and so on and so forth. I think that was a misinformation which we carried forward. And with that, we could not get ourselves, we couldn't get our ass together very much initially. But Lagos State government did very well. They were ready for it. Lagos State government was ready with what they have on ground. And you could see that is the only state where we have real isolation center, testing center, and personnel that have been trained to handle that. But we have pockets of people like in Abuja. The epidemiology unit in Abuja is also trying, they're working, they're doing well in trying to trace some of these things. But you see, the public, out of fear, required more from our health system. Like the one they had in Enugu, they were not prepared for it. And where they kept the person was an eyesore, and even the family complained about it. They made so much noise about it. And it is only then that the government said, okay, I'm releasing 20 million. But that should have been released earlier. And things would have been put in place earlier. You don't need to have an index case to start preparing for this. This is where we are getting it wrong. Most of the states now are saying, oh, we are doing this, we are doing that. It is something that we should have done much earlier. And like you said, that is why the Western world is paying very heavily for it now. They have efficient system, but they did not deploy that system for this disease initially. And by the time they knew, they were caught flat-footed. And that's why the mortality is high. We, on our own side, we are lucky. It's coming in trickles. And I pray that we should be able to handle that. But there is a problem.
Which is?
Without shutdown, you may not be able to control this virus.
When you talk about shutdown...
Total shutdown.
Total?
Yes.
Why do you say that?
You see, there are those who are infected that we don't know. And they be going about infecting more people. Just like we said, a lot of people are asymptomatic. And they are going about infecting people here and there. And when they infect people, those ones will catch the disease and spread it more. You catch and spread it. It's like when you throw a stone at the center of a pool, you see ripples. You just keep coming up, getting wider until it gets to the edge of the pool. That's exactly what this disease does. And so if you don't shut down, you may not be able to catch those silent ones that are moving. Now, but when you shut down, you will be able to control spread. All those who already have it will be enclosed in a particular area, and it will be manifesting from that, within them from that area. And because the incubation period is about 2 weeks.
Yes, 14 days.
14 days, maximum. It can be 1 day, it can be 5 days, but an average of 5 to 6 days, but up to 14. So if you shut down for just about 3 weeks, those ones that were infected at that time will be manifest. But they will not be able to spread it beyond their confines,
their location.
You see it? So, and that's what China did. That's what Italy and all the other European countries are doing, because that is the most effective way to handle it. But can we do that in Nigeria? That is where the problem comes.
We seem to have arrived there a bit late.
Not even that. You see, like the presidential team said, we monitor things and take actions according to how things are unfold. You could find out that many of the cases we have were imported cases. Over 20-something of them must have had some travel history to US, to Britain, to Italy, and all these places, and they're importing this into us. That was why the federal government had to shut all the international airports, at least for 1 month. So let's handle the ones that have already come in and the havoc they have caused, and then see how we can contain ourselves. But for the internal person-to-person spread, we need this shutdown. Now, this shutdown will cause a lot of problem for people, and that is what the federal government is being careful. You have to consider the economy of the people. Somebody who eats from hand to mouth goes out every day to get money to eat, and you tell him to stay indoors for 3 weeks. How will you feed him? How will he take care of his family? That is the problem. In those other areas, they have social security systems whereby if you are denied your means of livelihood, the state government, the federal government can sustain you for a period of time. Can the government do that now? The federal government is voting billions for this COVID-19. I will wish that some of these billions will be used for social problems. They can use it and say, okay, if you are indoors, you can have this, they can buy food and distribute to people and keep them indoors. The Okada man who goes out every day to go and get money to eat, if you stop him from going out, how will he feed his family? After a while, he will revolt. A hungry man is an angry man, he will revolt. And when he goes out, he's arrested. That will worsen the problem. You throw him into some detention. The family is languishing in hunger, and he's there in detention. Before you know it, more people will die from hunger than from COVID-19. That is the problem the government is having. But that will be the ultimate solution for this COVID-19.
Now, as you speak, several things seem to throw themselves up. One, when you talk about, a total shutdown, it brings to mind personnel. And now I'm talking about medical personnel. and it's part of what I was making reference to when we were talking about the health systems
Yes.
a bit earlier. In our own situation, I mean the Nigerian situation, we've been battling with inadequacy in terms of health personnel across board. Now, for this kind of operation to work, the kind of lockdown, shutdown of people, stay at home and so on, we are going to need not just personnel, but skilled and trained personnel for this kind of activity, for this ailment. Have we done any of that?
Well, yes, some people, in fact, when you do a shutdown, you will need less medical personnel eventually to handle the situation. Because if you don't, you will soon be overwhelmed by the cases that will be coming up.
To the hospitals.
To the hospitals. You see it? So, Nigerian medical system has always been at the low ebb. It has always been that. The WHO said you shouldn't give less than 15% of your budget for your health. But we have 3%, 4%. We can't get enough for that. We can't get enough for that. So, the little we have, that is why we have to manage what we have very well. The Nigerian health system can be easily overwhelmed if we are not careful. We are dealing with just 40-something cases now.
As that now?
Yes. And these things grow geometrically for a while until some control is gotten over it. So we should brace up for more of these cases for now. All these, they are tracing about 1,800 people, contacts. Some of them will eventually manifest. So that's why the federal government is asking those who have retired, both from the military, from the civil population, to come out and assist. And some of these retired people have the experience. They may not have the strength, but they have the experience. And they can mentor the younger ones. They can also give some help. So until that happens, we may be overwhelmed.
Now, the other aspect, of course, still talking about the medical personnel, is the health of those medical personnel themselves. Because if you are going to be exposed to something that is extremely contagious like this, some form of protection for you, who is supposed to be taking care of victims of it, is necessary.
Yes.
How are we doing with that?
Well, I wouldn't be able to tell you exactly how far the federal government has gone, but doctors are complaining because we need what they call the PPE, personal protective equipment,
right,
which has to do with goggle, mask, the bodysuits, the headgear, and all of those. They are in short supply, but fortunately, I think this Chinese man, Jack, has brought something into the country. That might help us. That might help us. At the hospitals, doctors are complaining. And we said, okay, what you will do, at least in the interim, is if you can get masks, get gloves, get infrared thermometers to avoid contact. Those can help for the screening. And then those that are positive will be taken into isolation, where these other protective things will be very imperative if you are dealing with those ones. But if you are doing just screening in the general population, you don't need to wear body armor and so on and so forth.
Now, Prof, as we wind this down, there's a lot of panic, some would say unfounded. But because the prognosis is that what we're dealing with now is not a one-off, we are likely to be back dealing with something similar to this in the not too distant future. If you were to identify 2-3 things to those who are listening to you, the critical stakeholders, government, of course using the healthcare system, the people themselves who would be potential victims and so on, and then those in the middle, healthcare professionals like like yourself. What would those things be?
Let me start with the general population. We have to up our hygiene. You see, Nigeria, the mantra that dirty, no they kill black man, that's deceitful. We have to make our environment clean. Wash our hands regularly. You don't need COVID-19 to tell you to wash your hands, to sanitize your hands. If we have imbibed that culture, then government will not be telling us to be doing that. The health personnel will not be telling us to be doing that. So we have to keep our environment clean, eat healthy, because immunity is very important. Eat healthy. Now, for the government is to invest in the health sector. A time will come when you can't fly anybody out. If the president gets ill now, you may not be able to, they say, accept emergency. You may not be able to fly him out. You see?
Or even if you could fly the person out, you may not be able to enter the country into which you want to.
Enter because they won't even allow you to come in. You see it? So the best thing you can do is to improve your own health sector so that at least you can do what is reasonable here. That's what the government needs to do. And for the doctors themselves, we should, in medicine, you have the clinical people, you have the research people. The clinical people, we have to collaborate with the research people so that we have what we call evidence-based medicine. And they would, whatever they need, those in research will work on that and find proper solutions for them. You see? So these are things we need to do.
Prof, thank you so much for speaking with us.
It's a pleasure.
Thank you very much.
It's a pleasure.
And that's this week's edition of Newsnight. Thanks for being with us. We'd like to know what you think of the conversation. Our handles are right there on your screen. I am Ladi Akiridoluale. Goodbye.